Welcome to another video of Simplified. This video is about the new coronavirus disease, which has been declared a global health emergency by the World Health Organization (WHO). This disease, named COVID-19 by WHO, has killed more than 3,000 people worldwide following an outbreak in the central Chinese city of Wuhan. More than 98,000 cases of infection have been reported globally, most of them, around 80,000, in China. Outside China, cases are reported in more than 90 countries. Around 80% of these cases are from just 3 countries: the Republic of Korea, Iran, and Italy. Recently, 30 cases have been reported in India as well, out of which 3 have recovered. This video will be in the form of answer to frequently asked questions such as what is coronavirus, how it is different from seasonal flu virus. At the end of the video, we will see the guidelines provided by WHO to protect ourselves. First obvious question is, what is coronavirus? According to WHO, coronaviruses are a family of viruses that cause illnesses ranging from the common cold to more severe diseases such as severe acute respiratory syndrome (SARS) and Middle East respiratory syndrome (MERS). Coronavirus are zoonotic, meaning they are transmitted between animals and people. The name coronavirus comes from the Latin word corona, meaning crown or halo. Under an electron microscope, the image of virus looks like a solar corona. What is COVID-19? The illness that started in Wuhan. The first report of the Wuhan coronavirus came on December 31, 2019. The novel coronavirus is a new strain that had not been previously identified in humans. Little is known about it, although human-to-human transmission has been confirmed. Scientists are uncertain where this virus originated. What are the symptoms this coronavirus causes? The most common symptoms are fever, tiredness, dry cough. Some patients may have nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. The virus can cause pneumonia. In severe cases, there can be organ failure. Some people become infected but don't develop any symptoms and don't feel unwell despite having virus. What is the amount of time between infection and the onset of symptoms? Current estimates range from 1 to 14 days. Most infected people show symptoms within 5 to 6 days. Who are the most affected people? Older people and those with underlying medical problems like high blood pressure, heart problem, or diabetes are more likely to develop serious illness. Your chances depend on the range of factors like age, sex, general health you are in. The death rates were lowest for under 30s, 8 deaths in 4,500 cases. Is virus being transmitted from person to person? The disease can spread from person to person through small droplets from nose or mouth when a person with the disease coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch this disease by touching these objects or surfaces, then touching their eyes, nose, or mouth. It is spread via droplets, not air. Can COVID-19 be caught from a person who has no symptoms? The risk of catching it from someone with no symptoms at all is very low. However, many people with the disease experience only mild symptoms, particularly at early stages. It is therefore possible to catch COVID-19 from someone who has, for example, just a mild cough and does not feel ill. Why is this worse than seasonal flu? Both COVID-19 and flu cause respiratory disease and spread the same way, via small droplets of fluid from the nose and the mouth of someone who is sick. However, there are some important differences between them. First, COVID-19 does not transmit as efficiently as flu from the data we have so far. The second major difference is that COVID-19 causes more severe disease than seasonal flu. While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. That means more people are susceptible to infection. Globally, about 3.4% of the reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Third, we have vaccines and therapeutics for seasonal flu, but at the moment there is no vaccine and no specific treatment for COVID-19. Are antibiotics effective in preventing and treating the new coronavirus? No, the antibiotics do not work against viruses. Is there a vaccine, drug, or treatment for COVID-19? Not yet. However, those infected should receive care to relieve symptoms. Most patients recover thanks to supportive care. Recovery depends on the strength of immune system. Many of those who have died were already in poor health. However, more than 20 vaccines are under development. Now, most important, how can I protect myself? First, avoid close contact with people who are sick. Cover your mouth while coughing and maintain a distance of at least 1 meter from people who are coughing or sneezing. Avoid touching your eyes, nose and mouth with unwashed hand. Wash your hand often with soap for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Thoroughly cook meat, eggs, etc. Stay aware of the latest information on the COVID-19 outbreak available on the WHO website and through your national and local public health authority. The silver lining is the low observed mortality rate of COVID-19 at 3.4% globally based on the available data till date. This rate is lesser than previous outbreaks like SARS or MERS. More than 55% people have recovered from COVID-19 till now. Most people who become infected experience mild illness and recover, but it can be more severe for others. Take care of your health and protect others by taking necessary protective measures. Also, share with authority if recently traveled to infected countries. Hope you found this video informative. Thanks for watching.